The Hospital System Capacity Building Initiative, a 5-year CDC-funded grant, supported implementation of cancer screening and prevention interventions in 20 hospital systems across the United States. Utilizing a community of practice approach, hospitals, departments of health, and community organizations came together to improve population health outcomes. Sites were focused in one of 3 areas to improve population health: colorectal cancer screening, breast health equity, or HPV vaccination. This video represents the impact of this project and all partners engaged, with highlights from 2 of our community of practice sites.
The American Cancer Society is committed to ending cancer as we know it for everybody. And we do this by serving patients, caregivers, families, and clinicians across the country.
American Cancer Society received a grant, and they offered hospitals all across the United States an opportunity to apply for the grant. Some were going to work on increasing mammograms, some were going to increase colonoscopies, and we were picked here in Lakeland, Florida, to increase HPV vaccination rates in order to decrease cervical cancer rates. We were able to come together and increase HPV awareness for our community because we saw that the cervical cancer rates were going up for younger women.
So over the course of this initiative, we were actually able to increase HPV vaccination rates 31%. Our partners were open, they were collaborative, they were innovative, willing to have really important conversations, but also willing to unify around a really great message for our community.
So I think for us to come together and to offer our community highly reputable people and to teach them and offer our educational workshops, I'm very proud of that, and the fact that we were able to increase HPV vaccination rates.
I'm most proud of how our team pulled together, from our pediatricians to our frontline staff. We felt that we had a mission, we were all in it together. And that helped us discuss it with our friends, our family members, our neighbors. We could talk about the vaccine and the cancers it prevents, and showing that getting that vaccine early really provided a lifelong protection.
This was a collaboration between the American Cancer Society, the Vermont Department of Health, Southwestern Vermont Medical Center, Vermonters Taking Action Against Cancer, and Dartmouth Health Center. We were asked to apply for this opportunity based on a previous grant that we were working on in regards to colorectal cancer screening. This is a small rural community hospital, and we didn't have the people and the resources and the time to really take on a project of this scope on our own.
If we look at what our baseline number of colonoscopies per year was in 2018 and compare them to post-project results in 2022, we had increased our colonoscopies by 28%. And that's really impressive when you consider that most of that time was during the pandemic. Of all the projects I've worked on, this was one of the most rewarding just because of the amount of support that we had.
It's really exciting to have those established trusting relationships that we can carry forward in a lot of new directions.
To have that opportunity to have national exposure and access to national experts really propelled our ability to accomplish these great results.
So often these types of projects, you don't see a result for a really long time, for years, decades, generations. And so for our work to be rewarded with seeing that increased screening rate was really exceptional, and I think goes to show what a collaborative effort can do to improve health in a community.
We started in 2018. We had really incredible hurdles to overcome during the COVID-19 pandemic. My sincere gratitude to all of the communities of practice partners across the country that participated with the American Cancer Society in this great effort. We all stuck together, and here we are on the other side of it and have had great success in seeing through this project.